Welcome to Field Notes, Insights from N2PH Health Alumni. N2PH Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, N2PH Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making. Joining us today is Abbi Brown, public health nurse with Rock County Public Health in Wisconsin. Abbi graduated from the N2PH Health Residency Program in November 2022. Abbi, can you tell us more about your work with the Maternal Child Health Unit in Rock County?
Sure. So I started in public health at a very weird time in 2020, where people might remember a small pandemic that was happening at that time. Um, so I had no public health knowledge coming into my role. I was kind of just looking for a career change, and I thought this would be a good fit. So when I started in public health, I was given the chance to pick what unit I wanted to be in. And I decided on the maternal child family health unit. At the time, I was going to be a new mom, and I just thought it made sense. Maybe I'd learn something from my job that I could kind of apply to my new role that was coming on. Um, and I have not regretted it since. So, with my role, a couple of the things that I do within the maternal child family health unit are our childhood lead poisoning program. We also have a child death review and a fetal infant mortality review team. And I am also a part of the Asthma-Safe Homes Program. So they're all kind of a little bit different programs, but really fit inside wanting to help, like families in our community.
What a great way to kind of mesh that passion from your personal life into the work that you're doing for your community when you first started. Can you tell us a little more about the Asthma Safe Home Program?
Sure. So it's kind of a unique program. Only two health departments in the state of Wisconsin are a part of this program. There's a couple other community partners in different counties that do this, but not many health departments have come on board yet. Basically, what the program is it provides free asthma education and home repair services to qualifying families within Rock County that have poorly controlled asthma. The goal is to help families understand what their asthma is, build those self care skills, reduce the triggers, and ultimately, the overall arching goal is to reduce healthcare burden and unscheduled ED visits within our county. Um, and through this program, I also decided to take an extra step and I became a certified asthma educator because I felt like that was going to help me serve some of our clients a little bit better in Rat County. Um, and we have our goal for public health is to help everyone reach their full health potential. So I really like this program because I feel like it fits into that really well.
Yeah, it does. What have been some of the perceptions of the clients you've worked with or the community and the fact that you're able to offer this really unique program that other areas of the state don't have?
I think our clients have really appreciated it. We don't have a lot of asthma providers here in our county, so we're able to bridge a little bit of a gap between people who maybe aren't as understanding about what their asthma means. Sometimes people kind of downplay it, or they don't fully understand how it is affecting them. So I think it's helpful for them to kind of bridge that knowledge gap. And I think it's also helpful for our providers to have somebody that can help the family, especially with some of those home remediation things, to get rid of some of those triggers that are making a child's asthma worse.
Yeah, really looking at some of those environmental factors and those social determinants of health to build, bridge access to care to combat and address asthma for the individual and
Mm-hmm.
rates in the community. That is excellent. Well, I think this is a really innovative program, and I thank you for doing that type of work and leading the way for asthma-safe homes in Rock County in Wisconsin. You entered the New to Public Health residency program when you were relatively new in your role. Is there anything that you took from that program that allowed you to do the work that you're doing now?
Yeah, like I mentioned earlier, starting in such an unpredictable time, especially in public health, I really didn't get the traditional orientation process. So learning any sort of governmental health or just governmental job in general, when you really don't have a lot of the background knowledge, can be pretty daunting. So I think this program really helped to get a good grasp of what it meant to work within a governmental agency, specifically public health. And one of the things that I really enjoyed with this program was having a mentor. The mentor that I had was also a public health nurse in Wisconsin, just in a different county from me. And she either did or was currently doing a lot of the same things that I was doing and I was trying to learn. So it was so nice to just be able to bounce ideas back and forth off of her. Even though our counties maybe did things a little bit differently, the overall concept was the same. So someone that had many, many years, 20 plus years, I believe, of knowledge, um, it was so helpful to be able to just talk with her and learn a little bit. And we were able to meet up and kind of have a day together. And she was able to just show me how another county worked and showed me some of the policies that they had that I could try to bring into our county. And I think just that networking is so important in roles like this.
Yes, it is. And I'm so glad to hear your mentor was able to provide that support. For our listeners, Wisconsin is what's called a home rule state. And the saying is that when you've seen one health department in Wisconsin, you've seen one health department in Wisconsin, because we're all unique. And it is so great to be able to have those connections with others outside your jurisdiction to learn and potentially collaborate and really um, work off of the work that each other are doing to ultimately benefit our communities and build that stronger network of support and in turn confidence and competence. So it
Exactly. We don't want to reinvent the wheel.
Yes, absolutely. And especially for us public health nurses, it's great to be able to have that support in even a smaller uh, network of professionals.
Mhm.
Excellent. Well, Abby, thank you so much for being with us today and sharing about your work in the maternal child health unit for Rock County and specifically expanding on the asthma safe homes. We really appreciate your service and dedication to the health of your community and appreciate you talking with us today.
Yeah, thank you for having me.
Thank you for listening to Field Notes, Insights from New to Public Health Alumni. For more information, visit new2publichealth.wisc.edu.